Hello, everyone. So it's my privilege today to be presenting our webinar from the section on medical education on how to conduct a needs assessment for a Med-Ed grant application. My name is Justin Louis, and joining me today are Nancy Stewart from the University of Kansas Medical Center and Tessa Steele from the University of Washington, which I'll give more formal introductions in a little bit, but to kind of set the ground a little bit, let's talk about needs assessment. I think a major question has been, what is a needs assessment? So the needs assessment answers the following: where is the learner? What are the behaviors or the values, attitudes, knowledge, and skills needed to achieve the goal of the curriculum? And there are multiple types. These include a gap or discrepancy analysis. So for example, comfort level with point of care ultrasound. Another one is self-assessments by logbooks, for example, work duty hour limits. Another one is observation or peer review. So for example, giving adequate sign out. Significant event review is another method of the needs assessment. For example, verifying code status on admission. And finally, there's practice review. So for example, use of a CAM score for identifying delirium. So how do we collect the data for needs assessment? So these include surveys as well as interpersonal interactions. So these include formal interactions, for example, focus groups, interviews. These also include informal, for example, discussions, town halls. There's also there can also be a review of existing curriculum. So most commonly we use what's called a SWOT analysis. So strengths, weaknesses, opportunities, threats. And finally, there's literature review. So looking at what's out in the literature in terms of some of the curricular activity that's out there. So I'm going to introduce our panelists today. So here from our panelists today, Nancy Stewart, who is from the University of Kansas Medical Center, who is our ATS-SOME IC chair. And I'm delighted to also welcome Tessa Steele from the University of Washington, who is the grant awardee of the 2024 ATS-APCCMPD Joint Medical Education Research. Welcome, everyone.
Thanks for the introduction.
Yeah, thank you. Thank you for having me.
And so I'll start off with some questions. Please start off with, please share with us some of your experience with putting together a Med-Ed grant.
I can start and I'll provide a little bit of background about myself too. So I am a physician scientist actually by pathway, so writing grants is something that I do, but this was a really great opportunity that allowed me to pursue my education interests also, just working in academic medicine and having been a recent trainee of a T32 program, and sort of myself going through the process of trying to become a physician scientist, taking a step back in this moment that was pretty proximal to me to think about, what are the barriers and facilitators to becoming a physician scientist? How do we help our trainees kind of navigate this path? And the grant mechanism that was offered through ATS was just a really excellent opportunity for me. And I can talk more about the details of that, but maybe I'll just start with that background. And so, we pursued my mentor and I, who was our former fellowship director, and me as a recent trainee in the program, pursued this mechanism to really try to understand barriers and facilitators to becoming a physician scientist. So that's maybe some background. I'll turn it over to you, Nancy, so that people have more context.
Yeah, thank you, Tessa, and thank you, Justin, for having me. So a little bit about me as well, and then kind of my lens on this. So I'm also a physician scientist. I'm also a trained educator. I actually did a 2-year medical education fellowship in medical education research. And so I feel like I look at so much of my own research through the education lens. And so the needs assessment is actually just one of several of the different cogs in the wheel in terms of the steps for medical education curriculum development. And so I think that when I looked at this particular mechanism, our grant actually came out of a wellness pod, so one of the scholarly pods that's through the ATS education section. And our pod was thinking, like, what can we do together? And that's kind of how we viewed this. And so it was a group effort. It wasn't just me or just one other person. It was, I think there were a total of 5 of us on the grant. And so we did have that aspect of having educators and various folks interested not only in education, but from the majority that I can kind of think off the top of my head, I think we were all in academia as well. And so this want to teach, but want to learn more ourselves and want to have a scholarly output, I think was all part of our thought process in putting our application together. I don't know if there's more to that question or if I answered it sufficiently.
Thank you. Since both of you mentioned your roles as physician scientists or your background as a physician scientist, what are some of the key or main or general differences between med-ed grants from other types of grant applications?
I think in this process for me, I had to look into, I will say that when I applied for this grant, I had been engaged in a working group at our institution, sort of doing some internal research basically about our training program. And so we had started a process, to the point of the needs assessment. We had been doing a needs assessment that was fairly formal, interviewing our recent trainees about barriers and facilitators to them pursuing science as opposed to leaving for other opportunities. And so, I think it was recognizing that what had started as kind of more of an internal process, I think similar themes to what Nancy is saying as well, recognizing that this is scholarship and that we could sort of broaden the scope of our internal work and make it more of a externally useful body of work. So then what we pitched was, could we take this sort of interview structure that we developed for our internal program and then start to interview people around the country at various T32, recent participants in various T32 programs, and develop more generalizable knowledge? And that's where it sort of crosses over into research, but it's very much rooted in, how do we improve our own education in our institution? And then I think this opportunity, really challenged me to think about, okay, well, how do we make this work more impactful? And I think that's where these grants can be super helpful, because we wouldn't have had the resources to really engage and recruit people without paying for their time respectfully.
No, I absolutely would agree with that, Tessa. And I think again, with my med-ed hat on curricular development from a scholarly perspective, and this is where I have to encourage my colleagues to kind of think outside the box, because so many of us in academia, especially in education, we think, oh, I'm going to make this cool curriculum. I'm going to get feedback from people. They're going to tell me what they like and what they don't like. And then I'm going to tweak things and move forward on the next iteration. And to some degree, that's great. But I think that every step of curricular development, and again, needs assessment being one of them, each of these could be and can be and should be a scholarly component and a scholarly output. And it really, it doesn't take a whole lot more. And again, maybe this is just, my background and my training. And so the way I was kind of trained to look at it, but it doesn't take a whole from the back end, really impactful on the front end of it. And so for instance, when I'm talking about, for our project and for any other educational pieces, the literature review and the, needs assessment, if you will, is so critical, because if you do it well, it really can be like super informative of what the gaps are, where the gaps are, and then like your idea most likely is going to fill one of those gaps. But that's what's so hard about medical education research in general, is that we can't, like, nobody's going to pay for that. And that's what's so wonderful about this grant mechanism, is that it does pay for that. But again, like Tessa hit the nail on the head, it's a low amount in terms of, what other foundational grants or NIH grants are paying. But from a needs assessment, from a small piece of the nugget, you really, if you plan in the right way, you really can get a golden nugget of information. And wonderful scholarly output.
Mm-hmm. But I think when you, to the point of,
sorry,
I took us off track. And so I'm trying to like put us back on the point of the question, but how is it a little bit different? What are the main differences? I think it is that there isn't a large literature always that's directly relevant, I think, to the background, because, a lot of what you're doing is just characterizing the gaps, and therefore we need a needs assessment, but your gap may be bigger picture. Like, for me, the gap was, we have a leaky pipeline in terms of, physician scientists. There are few, and there are fewer now than in the past. And sort of, so you have to be a little bit, you're not going to have often a very large body of background literature that you can cite in your background, and for me, that meant I needed to provide a little bit more preliminary data, from our own institution or myself, to kind of fill the gap and explain the problem and convince, I think, reviewers maybe that this was feasible work and important work, so I did apply for this grant kind of after already launching the project in some ways.
No, I think you're right. And I think from just the term needs assessment, that can mean anything, truly. Like that can be a literature review and showing the gaps. That can be a institutional, semi-structured interview to then take that piece of information and those gaps and then broaden it to, another institution, or that can be divisional and interview a couple of people, or that can be clinic based and get a small needs and then broaden it to a department or broaden it to the whole institution or all of GME. Like a needs assessment just means showing why you need what you need, and it can be like your resources to get to that can be any number of different things.
Well, that kind of segues into, what kind of needs assessment did you put together for your meta grant, and how did you do it?
Yeah, so I kind of alluded to this, but we did several interviews, and then did some analysis of those interviews such that we had some initial results that we could present, and then we could demonstrate why this was insufficient, what we needed from other institutions to sort of understand whether some of the things we were seeing were generalizable or maybe just specific to the culture of our institution. And we felt that was important. So some amount of like I said, launching the project and getting a little bit of information was really helpful in my case.
Yeah, and same in our case. I mean, our group worked on a financial education curriculum, and so we had a questionnaire that we kind of came up with amongst ourselves, and then we sent it to the program directors and the APDs within our own institutions that made up our pod. And so if I recall, I think it was 5 or 6 different programs that we essentially surveyed, but just to get basic feedback as to how comfortable they were talking about finances, how often they talked about them, was it even a part of the, fellows curriculum or not? And the large majority responded back that, you know, they may have their own financial planners, but certainly not something they talk with about their fellows, nor do they, you know, put any time or effort or energy into it. And they may have had somebody along the way come along and say, oh, I'd offer to speak to your fellows and here's my business card. But other than that, like that was really it. And so that's what made us put a survey together with some of their feedback into it's a little bit more robust that then we sent out, you know, to multiple institutions. And so again, that can be looked at as somewhat of a two-part needs assessment. The first needs assessment was just surveying our own institution and getting feedback from that. And then the survey creation was just from what knowledge we had within our own group, working group. And then when we got feedback from folks and were able to change the survey to respond to, you know, what different participants had mentioned, we actually got a very robust response back from folks from multiple different institutions that then laid the foundations for a financial curriculum to be developed, which then we were piloting at one single institution. But I think that again, this is like shifting my med-ed and my scholarly hat back and forth, because each of those can be a manuscript, it can be an abstract, it can be presented at APP or APCCMPD or at ATS or CHESS or like any of these different conferences, and showing the value of it and the gap that it fills and the need for it is where I think folks that are applying for these types of grants, that's really the golden ticket to getting one of these funded. Is I don't think that it's a challenge, more so as it's like really sticking to and showing the value and the significance of your idea and the gap that it fills.
Mm-hmm. Which is only going to make you think more rigorously about it. You know, like I think that when you put together when you articulate the rationale for what you are doing, you will refine what you are doing, you know, and your approach will only become more rigorous, and the product you make, the skills that you learn and along the way. So it's all very worthwhile, though it is work on the front end. It's going to pay off like in dividends down the line.
Absolutely. And I think the thing also that that I learned in my training, but that I didn't know beforehand, and that I hear from other colleagues that I don't know how to do that. I don't know how to write a grant. I don't, you know, and I'm still, I mean, I am absolutely no expert in grant writing. I've had more grants, you know, like I've had more no's than yeses. But I think that when you learn to articulate something to someone else that doesn't understand your area, that's where you learn the beauty of grant writing, because you need to convince somebody that does not understand your area or this piece or this gap. You need to make them understand the why, and if you can do that, then I would be shocked if that grant doesn't get accepted. You know, mm-hmm. that's the challenge. And I think that's like in having other folks that don't understand your area, if they offer their time to review it, like I tell my trainees and my colleagues, like red is love. If they will redline something for you and tell you how to fix this or how to reword this to make it more convincing or more understandable, that's where you like dive in and edit and edit and edit, because less of the science and more of the just verbiage and articulating the why.
Mm-hmm. Agree.
Oh, what was the hardest part about putting together a needs assessment?
I think it's in telling a coherent story. It's sort of exactly what Nancy is talking about. It's connecting the big picture significance down to the sort of nitty gritty of what you are trying to do, you know, and making that fluid. But it's such a I can't, I mean, that's not just a research skill, right? That's a skill that is so cross-cutting that, you know, that's what educators do too, right? You know, here you are, medical student or resident, you know, we're going to teach you a specific skill, but how does it relate to the larger you? You know, so I think, but it is challenging, you know, and writing can be challenging. So I think that's what it is, a coherent story. But like that struggle is I think rewarding.
We all
too.
struggle with it, you know, and I think
Mhm.
I would say the hardest bit, the first sentence that you tell many of us long, but we may have a room to present it, but it's just putting thought to paper, you know, and then sharing it and having somebody that you trust. I mean, I often my get frustrated about a topic or an idea, and my partner says, well, can you explain it slightly differently? And then I verbalize to my partner, well, but this. And then he says, well, but what about this? And I thought, oh, I didn't think about it. So it's just trying again and again and again to like speak English. That's the beauty, and how to really, you know, have a slam dunk of a grant is to speak English, because people, like, the science is like 5% of it. Um, but you're a salesperson. Like, this is a sales pitch, and you've got to convince the reader why they are gonna. I mean, it's almost like I've heard the analogy. I don't really like it because I feel like it's not the kindest, but I've heard the analogy like used car sales. Like you're trying to convince somebody why to buy that car, you know? But like you're trying to convince somebody like that grant, your grant, like what's so awesome about it? And like 5% of it's the science and 95% of it's the pitch. And so it's how do you convince them, and it's in English. It's not about, you know, this particular molecule and enzyme does this to this microbial whatever. Like that, you've already lost me. You know, I'm moving on. But if you convince me that this is going to cure cancer, or this is going to, you know, every medical student goes from having 4 years of education down to 1 year. Like, okay, I'm going to read more. You know, so it's the pitch, it's the sales pitch, and that's there are often like I'm getting frequent emails about like writing conferences and how to write better as a scientist. The scientific writing is like it's hard, but that's more for manuscript writing and less for grant. They're two separate ways to share your knowledge. One, you're trying to share what you put together, but the other, you're trying to get someone to pay you, you know. And so they're a little bit they're very different skill sets. But I think from a which is easier, it's almost like our brains have been trained to science, and so it's almost like putting the manuscript is somewhat easier as opposed to like writing the grant, because that's the sales pitchy part. Like none of us, you know, I mean, but in education, we much of what like Tessa nailed the you know the nail on the head. Like a lot of it is trying to get somebody that has no clue what we're talking about, like have them learn something. And so a lot can be learned from our own colleagues and our own fantastic medical educators as to how to put this together.
Mm-hmm.
Really cool. Very insightful. Any advice or any tools or resources that you used, or you know, to kind of get started on a needs assessment?
I think that it comes from conversation probably first, right? Like understanding that other people say, "Oh yeah, this is an issue we need to dive deeper into," right? You know, so my project very much just came out of, "Oh, this is an issue that I encountered as a trainee. Now let me talk about it to higher ups and other, you know, and just get some initial feedback." Also, like Nancy was saying, with colleagues, friends, people that you trust, but various perspectives to see how does this idea land, you know. And so I think those early stages are just not being shy to kind of strike up some conversations. You know, I have this idea, and what do you think about this? How do you think we'd go about, gathering more information about this, and kind of just informal surveys, I think, are really helpful in the early stages.
Absolutely. Absolutely. And I think that things like this, like, listening to podcasts about other folks that have walked that same walk and I mean, Tessa and I are, like, there have been many people that have gone before us, that have paved the way. But listening to our stories and other people's stories about, what to look into, how to go about it. I think the hardest part for some people can be the needs assessment. Like, what do I do? How do I start? And just like Tessa said, just with conversations, just like, you got an idea, like, that conversation doesn't have to be with, it could be with your program director or with your division chief or your department chair or your dean, but it doesn't have to be. It can be with a colleague, it can be at a conference. It can be, like, over a patient while you're intubating them. Hey, I thought about this. Like, what do you think? Like, conversation can go a long way. But then also, I encourage people, because I so frequently will get things come across my desk that are like, oh, this is my scholarly piece, or look at my scholarly work. And I'm like, what's the background of this? And then I look at it and I go, that's already been done. Like, how do you make yours novel? And so I think that's so important on the front end of, like, the conversation piece of it and the literature. Like, if there is literature, great, look at it. If there's not, have the conversations, and what's going to make it novel and worthwhile, that it's going to make somebody want to participate. It's going to make somebody want to pay you. It's going to make somebody want to pick this up in 5 years and read about it. That's what we're trying to learn.
Mm-hmm. Yeah, I like that point about this little bit of iterative. You have an observation, you talk to your colleagues, you go back to the literature, and you see, okay, what exists in this space? Then it starts to crystallize the gap, right? Like, and what kind of needs assessment is really needed based off of what's there, the problem I'm seeing, what's feasible, in my orbit. It's this iterative process that needs to be undertaken.
You don't have to be a medical education expert. You don't have to be a survey expert. You don't have to be a associate or a full professor to do these things. You can be a trainee. There's nothing wrong with that.
Well, in many ways, very informed, right?
Absolutely.
They're proximal.
They're so close to the issues at hand and the challenges at hand. Mm-hmm. And oftentimes I hear that many feel so helpless, and I'm like, no, like, you need to speak, share the issues, share the concern. Let's think about how we can view this and through what lens, so that we can come up with a scholarly way to make a change. Mm-hmm. And that change is so much needed, because if you are feeling this way, if you are experiencing this, if you are seeing this, or if you are worried about this gap, you're not the only one. Absolutely. And so I think that's where this grant mechanism can be so valuable to folks in training, whether it's a resident, whether it's a fellow, whether it's a chief, whether it's a medical student or an instructor. Like, we don't have to have $25,000 grants or $100,000 grants to make a change. We have to have an idea, and we have to have a conversation and say, I experienced this. Did you? Like, I saw this as a challenge. Did you? Like, what are you? And those conversations are what help you crystallize the gap and the goal. And then it's those conversations that you add to it and go, okay, probably not that way, but that's where things become, go to work through different iterations of it and have a product of something. So I honestly think all you need, Justin, is an idea and the willingness to talk to people.
Mhm.
It's not all about
And
what
iterate.
level in the
Mhm.
hierarchy of academia, or whether you're in a academic institution, or whether you're in a private hospital with residents and fellows. Like, it doesn't matter, because we all have there are issues everywhere, and there are people that are dealing with them everywhere that wish somebody else would speak up and say, I had that same issue too, or I have that same concern too, and I was thinking about XYZ better.
Mhm. Yeah, it's like a mechanism for broadening the conversation, really. Yeah.
I think that's a really nice way to put it. Yeah. Yeah. Now for a little bit more difficult question to answer is, what happens if when the needs assessment is different from what you expect? Have you encountered that, and how do you kind of pivot?
I think that's the beauty of research, honestly.
Nothing but that, right?
Because especially if you already have the money. If you already have the money, then what you're going to find is maybe not what you expected, but I think it needs to be shared, and I think it's all about going back to your team and saying, okay, well, this is not what we expected. Like, this is a little thought provoking, or a little angry. Like, can make people angry if they hear it, or but or make people excited that they weren't expecting X, Y, and Z. But I don't think change is a bad thing. I don't think that um research and data and knowledge is not a bad thing. Um, it may not be the outcome that we expect, but it's something. And if it's a negative study or a negative like, share it. And how are we going to pivot from it? And how are we going to learn from it? I have 3 young children, and I try and teach them with every and I'm not good at this, but I'm trying. But with everything that they come back and say, oh, it's every negative, I'm like, what'd you learn from it? Like, what are you going to do next time differently? Like, and I think that's where this can land,
Mm-hmm.
Yeah, it sounds like the takeaway is to be fearless.
I don't know. What are your thoughts, Tessa?
Yeah, I mean, what we've learned has just the way that we need to frame it has shifted, right? And that's been part of the whole process, and it's actually been a really cool part, is just how are we going to articulate this a little bit differently. And so I think that the unexpected, that's like, clearly there's gaps, right? And so it sets up really nicely the next body of work, when that's the case. So I think it is, and there's always kind of the, what good comes out of this? Well, the good is that, like, we have work to do.
Yeah. Sounds
more work than you expected, probably.
Right, exactly. Yeah, exactly.
Yeah, definitely. Now, if you had the opportunity to go back in time and redo your needs assessment, was there anything you would have done differently?
I don't think so, because we had several steps to it. So I think ours was fairly broad by the time that we got to disseminating it to a larger group. I think that may be somewhat of a I don't want to call it a downfall, but it may be somewhat of a struggle for educators or researchers when they have too narrow of a needs assessment, because then they don't get enough of a broadened picture of the problem. And so I think just having the mindset of, or waiting a little longer and gathering a little more data, more is not always a bad thing. Waiting a little longer is not always a bad thing. And not necessarily rushing, like 3 thoughts are awesome, but 4 can be better. And so I think that kind of an active mentor to say, okay, I think we have enough, like, we can move forward. But that's where, hopefully, like, having some of these small conversations open up so that it's more of a team looking at this, and it's not just one person that the like Tessa mentioned, like she had a mentor she was working with. In my case, we had a team we were working with, so we could kind of bounce this off of each other and go, do we think we have enough? Do we not? To then move forward. So I think that's really critical, because there's some really good ideas out there that don't have enough oomph to it, for lack of a better word, that could like just a little bit more filling of that pitcher up of milk, and then you're going to have like, a full pitcher. But if you just, and how do you know if it's full enough? Like, how do you know? And I think that's where the team effort and the mentorship come in and to kind of bounce that thought off. Are we ready?
Yeah, I mean, in this space, I mean, this is my first sort of med ed project, but I mean, I mean, qualitative methods. I mean, and even the examples, Justin, that you gave, I mean, surveys can be more quantitative, but, I think focus groups, interviews, like these are skills, right? These are, and I imagine that if you want to do more scholarly med ed work, that investing in understanding how to do some of these methods is really helpful. And then the challenge becomes exactly what Nancy's saying in qualitative spaces, is sort of, when are you reaching that point of saturation, or how can you articulate the findings in a way that they are usable to your, to the trainees, to the educators, to the various partners that you have. And that is, to me, the challenge in qualitative work. It's telling the story in a usable way. It's getting enough, input that you trust, the perspectives, that there's thematic kind of, consensus that's reached. And I don't feel that you can do that by yourself, right? You've got to have a team. You need to have a team of educated partners, co-investigators who also know this space, such that you can bounce the ideas off of each other. And so it's really fun work, right? It's really fun research that I think it has a natural home in medical education, right? And but yeah, I think the answer to the overcoming of that is the team base, that you're likely going to be working in teams in this type of space.
Agree. And I think the other piece of this that can be translatable to physician scientists is, when you break out and you're going to write a grant or you're going to step in a proposal, most of us are not statisticians. We have some stats learning and knowledge, but we are not. And so always they're like, my mentors and they're always saying, did you have a statistician on the team first? Did you have them review your ideas first? Never set out and get data and then go backwards and go, hey, stats person, can you help me? Loop them in early. So it's the same thing. Loop your team in early. If you're looking at qualitative work, loop a qualitative person, a qualitative researcher in early. It all of our institutions, or if you're in a private practice setting, like, reach out to folks. They'd be more than happy to help you, but they can help you craft it such that the data that you get, whether it's qualitative or quantitative, the data you get, your output and your outcome, is usable. Because if you don't include that person early on in the development of it, if you don't include that expert early on in the development of it, it's very hard to go backwards. And then that's where some people struggle and find the struggle and oh, I should have done, and really is a call or a quick email, like, hey, statistician friend of mine that I know, hey, qualitative PhD friend of mine that I know, can you give me your thoughts on X? But it takes, from their end, it takes much more time to go through it on the back, like at the end point, to go, oh my gosh, what are they trying to do here? As opposed to how to set it up so that you get whatever, whether it's a positive or negative outcome, like you get the outcome you're looking for. And so again, that's very similar to setting up on the right foot up for a needs assessment. Like do your due diligence first, talk to your team, look at the literature, whatever that due diligence is, do it first and bring it with you.
Yeah, so you might add, who are the key partners, who are engaged people. And a lot of times, like, our group has multiple physician scientists who care very deeply about the training process, but they might not themselves take on the grant. But if you, as someone who's interested in medical education, said, this is an issue that affects all of us, and so some of that like initial kind of what is the significance of my problem, doing that early allows you to then engage these people such that, this project is really fun for me because I get to work with these people that my research doesn't allow me to collaborate with them, right? But this mission does allow me to collaborate with them. And so, it's a unique opportunity for understanding aligned interests and then getting kind of a unique group of partners together, I think.
And I think you're absolutely right, Tessa. And I think from a educator perspective, the educator mindset of this, like this is where they thrive, if you put a physician scientist in that doesn't have interest in the vocalizing and verbalizing and the education piece of it, like how you're hoping to go from A to B, it's going to scare them. Like they wouldn't touch it with a 10-foot pole, so to speak. And so I think that's where, from an educator perspective, that's where these grants can be so valuable because like these are made for these folks, I think it's also up to us though, as educators and folks that know about this to spread that word, because it's from someone that doesn't know about this mechanism, that doesn't know how, what I think is so easy, like they don't know that piece of it, they're gonna shy away from it. And I can't, I don't know how, I don't have that skill set, I don't know. I mean, but you do, and you are the right one.
Mm-hmm.
And we're not writing to the NIH that's shut down, like we're writing to people that are thinking like us and that
care
want
about
to,
the issues.
they care about these issues and they want to, and I think that's one thing that we have seen over the last several years is that unfortunately, but hopefully this is being listened to by people that care about this. We're not seeing enough of these educators applying for this, and this is the initial mechanism of change. Like this can be how someone that has a research career path or wants to have a research career path, this can be that initial first step. It's so easy.
Yeah, or wants to engage in a sort of scholarship around their passion. Yeah, it's a great launching point. Yeah.
Now, I really like how both of you stress team. Did any of you have a mentor or mentoring team to kind of help you through this process of putting together a meta grant, and any advice on how to look for a mentor?
I definitely had mentors in this project, people that were just more senior, that had more experience in qualitative methods, sort of the methods that I'm using, these interviews, but I think it could be whatever sort of strategy you're thinking you might use. If you don't personally have a lot of experience in that space, that's when you're drawing in someone who maybe doesn't want to write the proposal, but is happy to share their expertise and mentor you in the process. And so I sort of had methodologic mentors in this work, as well as content experts. Sort of, I mentioned our fellowship director, because I'm not in the education space, but I was focused on kind of an education issue that affected all of us. I wanted, experts in this space to be able to say, okay, yeah, this is this is relevant, this is maybe less relevant, here's how I might articulate, that issue. And so the team is made up of several junior people and mid-career and senior. So it sort of spans the breadth, I think, of our division.
Our team was our pod, our scholarly research pod. But I think to someone that doesn't have either one of those or doesn't feel like they have a lot of resources, I think the medical education world is probably one of the friendliest in existence. And I think that anybody listening could probably reach out to anybody. And I mean, honestly, let's be honest, all of our emails are on the internet. Like, you can find any of us, and like, anybody could reach out to somebody and say, hey, I have an interest in XYZ, and I know that you so-and-so are an expert in XYZ. Do you have the time? And if you don't, can you share with me who might? And people in this space are so willing to cross-pollinate and to mentor or to share resources, because the mission is the same. The mission is, and a lot of it too. I mean, my initial mentor did a lot of work from a quality improvement perspective, and so many of her mentors were quality improvement people. They were, some of them were educators, but not all of them. They don't have to be, and so I think the term mentor can take on anything. It doesn't, you don't have to be in an ivory tower and have somebody that's got a title as mentor to be your mentor to do these things. But I think, again, that's one of the barriers and one of the walls that has to be broken down in all of this, is that people should be able to view these and need to view this particular grant mechanism as something that's reachable, as something that's doable, as something that doesn't take, a 1,000-piece band to get the team moving forward. It's one ask, it's one conversation, it's one email, it's one phone call that will then, can and should snowball.
You kind of alluded to this, Nancy, but for people who are interested in finding kind of outside collaborators, any advice on that?
Email, ask. I mean, I think if it hasn't come across clearly in this webinar today, I'm very outgoing. And I think many of us are, but some of us aren't. And I think you must get over that piece internally if that's something that, as an educator or as a researcher, you struggle with, because asking and sharing is part of it. And so you just have to take that initial step. I mean, it's almost like, watching an infant's first steps. It's like, oh gosh, are they going to do it? Oh gosh, they can. And then once they do it, they're off. And that's kind of what this is. It's like that first initial, like, you have to have confidence that your idea is good. And by asking other people that you trust, like Tessa mentioned, like having those safe space conversations, once you have that, like, just ask, like, any of us, anybody out there in this space is I have yet to have somebody, I have yet to have someone do this to me or have heard about it from someone else where they say, no, I'm sorry, like, that is the dumbest thing I've ever heard. And you're never gonna, like, nobody's gonna talk to you about that. You're never gonna get that funded. Goodbye. Unless it's coming back, from a reviewer on a grant. But even then, grant reviewers, their goal should be, and most 99% of their goal is to give you feedback that's usable, And so I think,
one of my grant reviewers offered to help with the project and volunteered his trainees.
Yeah, I mean, it just takes the task, and so, like, utilize your safe space. If that's your co-residents, if that's your co-fellows, if that's your, colleagues that are, mucking through it just like we all are, just have those safe space conversations. If that's your partner and at home, have that safe space conversation. And then ask somebody if you feel like you don't have the resources that you need, but you have the time and you have the passion. It just takes an ask.
Yeah, and I think I felt more confident with the ask once I had invested some of the time to have my own head real wrapped around my ask, I guess, and so I do think there is a little bit of that initial crystallizing the idea. You do the informal conversations in the safe spaces like Nancy is talking about, such that when you are ready to write the email to the person you don't know as well, you're kind of selling them a little bit. You're doing a pitch and it's a clear, tight, ask that certainly makes me feel better when I'm in the asking position. And I think it goes well in those scenarios.
It's kind of similar. I used to hear the word pitch in like what's your elevator pitch? What's your elevator spiel? What's your 90-second? Like if you're in the elevator with the president, what are you going to tell him about yourself? It's kind of like that. Like that takes a little bit of time to think about, like, what are you trying to ask for? But we all have it, and it changes over time. I mean, if we're going down the road of an elevator pitch, that's not for today. That's another webinar. But it can change over time, and that's where asking those in your safe space can help you change it and crystallize it over time and make it that golden nugget.
Very cool. And what were some of the things you learned from putting together your meta grant?
Oh my God. Like, I mean, I now can use qualitative research in a million different ways now. It was such an opportunity to get exposure to a type of scholarship that I had not had exposure to. And like I said, work with partners who are not in my research space, but are in my academic sphere, and where we can align on the importance of this work that affects all of us. So, it's been a huge learning and sort of fun collaborative opportunity. And also, like I mentioned, like the reviewers who are very senior at other institutions who reached out, and we've had email interactions. I think it's really it's so worth it to put it out there, because it opens up kind of a lot of opportunities for communicating and getting to know new people and learning new skills.
Absolutely. I mean, I couldn't say it better. Like, I think it builds bridges that people didn't know needed to be built, but like it's all improving the working towards the same goal,
And how did it help your career in putting together the grant?
Oh, well, definitely nice. The work is one thing, and then also you get a grant. You also have this thing that is a tangible kind of thing that you've accomplished, and it's highlighted at ATS. I mean, like a lot of people came up to me, said, "We saw your picture. We saw this grant. What are you doing?" So I think there's the actual work of it, and then there's also just that it's a really nice mechanism for kind of advertising your ideas too, and getting some credit on your CV and for promotions. And so there's so many arguments for it, actually.
All of the above.
Well, you had some really nice insights today in respect to putting together a meta grant and conducting a needs assessment. I just want to take the opportunity again to thank our panelists, Steele and Nancy Stewart, for their time and for answering so many of these questions on, where to start when we have a medical education idea, and how do we start with a needs assessment? How do we put together the grant application? How to kind of help with each of your academic careers?
Thank you for having us. This was great.
Yeah, it was super fun. It was great to chat with all of you.